Ready?
Yeah.
Okay. Urinary system is made by the two kidneys, the two ureters, and the urinary bladder, which should be lowered down like this. Okay? Urinary system, as you see, the two kidneys are not on the same level. The right kidney is a little bit lower down than the left kidney. Why? Because the liver is making that pressure to be a little bit lower down in level. If you look at this one, this mannequin shows quite clear how the liver makes the right kidney a little bit lower. This is the right one, this is the left one. So that liver, that big lobe of the liver pushes the right kidney lower down. This is the left kidney. This organ is called the spleen, which is nearby the left kidney. What are these two vessels? This is the descending abdominal aorta, and this is the inferior vena cava. Descending abdominal aorta gives a branch to the kidney, which is called renal artery. One to the right kidney, one to the left kidney, as you see. The inferior vena cava receives venous blood coming from the kidney through the renal vein to be in the inferior vena cava. Each kidney has a ureter coming down from the kidney going down to the bladder. So if you look at here, we have the two ureters going down. We have the renal vein, the renal artery, and the ureter on each side like this way. The urinary bladder, back to it, this is the colon, the descending colon, or the rectum at the lowest piece of the GIT. If you look across section in the kidney, as you see, the kidney is made of an outer cortex and an inner medulla, and more inner we have, this is the renal pelvis. Renal pelvis is the upper dilated part of the ureter. The upper dilated part of the ureter. Let's go for the medulla of the kidney. It shows these pyramids. These pyramids, each one has at its tip an opening called papilla, renal papilla, for passage of urine into the pelvis that way. These pyramids are named also calyces. The calyces are either minor or major. Each kidney has from 12 to 13 minor calyces. Every two will unite together to give one big major calyx like that. So the very common question, the pelvis of the kidney is made by major calyces inside it this way. Above the kidney, this is the adrenal gland or the suprarenal gland. Ureters are two long tubes coming from the pelvis, going all the way down to the bladder. When we see where do they go in the bladder, this is the urinary bladder. They enter the bladder from the back, and they are crossed by the vas deferens in male. These two are the vas deferens. Where do they enter into the urinary bladder? This is the urinary bladder. It has a triangular shaped area called the trigone. The two ureters enter at the upper two angles, and the lower angle is going to be for the urethra. This is the prostate surrounding this piece of the urethra. And inside the urinary bladder, if we study the urinary bladder, it shows these wrinkles or rugae. It's only found when the urinary bladder is empty, but when it's full, nothing can be seen inside the urinary bladder. If you look to the parts of the urethra in male, if you look at this diagram, like this, parts of male urethra. This is the urinary bladder. This is the urethra, starting from here. Will go inside the substance of the prostate. So this piece is called prostatic urethra. And then, opposite the pelvic diaphragm, which is this area, the muscles of the pelvis that make the external urethral orifice sphincter. This is the external urethral sphincter, and this is the internal urethral sphincter at that level. So this is the prostatic urethra, this is the membranous urethra. So again, membranous urethra is opposite the pelvic diaphragm or this muscle or the external urethral sphincter. And then the third piece of the male urethra runs inside the penis. We call it as penile urethra. It runs all the way and then it opens at the tip of the penis at the external urethral meatus. It's not a sphincter, it's an opening or meatus. That's it for the male urethra. In female, it's short, like 1 inch. In male, it could be like 8 inches long, and that's why UTI infections are more frequent in female. Thank you.